The human brain perceives objects through eyes. To compare and contrast then is but obvious. It's easy to describe the bean-shaped kidneys or the almond-shaped eyes, walnut-like grooves on the brain. Teaching and learning then is fun. It's easy. It's productive. Devise this video to compare various radiographic features to real-life objects like the spokes wheel or the cotton wool. Hope you enjoy learning with Dr. Shivani.
Multilocular radiolucent lesions have varied appearance depending on their internal arrangements. Lesions presenting with circular compartments of varying sizes that appear to overlap give the appearance of soap bubbles. This is seen in ameloblastoma, aneurysmal bone cyst, keratocystic odontogenic tumor, and central hemangioma. Another appearance shows small compartments that are uniform in size as seen in a honeycomb. This is commonly seen in hemangioma, calcifying epithelial odontogenic cyst, keratocystic odontogenic tumor, central giant cell granuloma, and ameloblastoma. A relatively uniform loss of density and intravascular calcification and subcutaneous ossification gives a ground glass appearance in the bone. Mostly seen in fibrous dysplasia, early changes in Paget's disease, hyperparathyroidism, and ossifying fibroma. Radiolucent multilocular lesions presenting with angular compartments that result from development of more or less straight septae and is characteristically seen in odontogenic myxoma. Ill-defined radiolucency with ragged borders that appear as something eaten by a moth is seen in squamous cell carcinoma, osteomyelitis, leukemia, osteosarcoma, and osteoradionecrosis, also noted in malignant lymphoma and Ewing's sarcoma. A unilocular radiolucent lesion seen with a cortical border and with a wider base and a narrower apex is seen in the residual radicular cyst. A radiolucent lesion with multiple rounded, dense, radioopaque patches of abnormal bone creating a cotton wool appearance are seen in florid cementoosseous dysplasia, the later stages of Paget's disease, and chronic diffuse sclerosing osteomyelitis. Multiple tiny, well-defined radiolucencies seen in the calvaria caused by resorption of trabecular bone. There is also associated loss of definition of inner and outer table of skull, giving the skull a salt and pepper appearance. This is seen in hyperthyroidism. Multiple discrete, well-defined radiolucencies of varying sizes giving a punched-out appearance can be seen in multiple myeloma and Langerhans cell histiocytosis. These are multiple lytic lesions seen with local disappearance of normal bone and resorption. Some lesions may also show trabecular thickening and each oriented in a circular manner, giving a spokes on wheel appearance. The lesions are mostly osteoclastic and have sharp margins. This is seen in cavernous hemangioma. The periosteum may show varied reaction to intraosseous lesions. A form of peripheral reaction manifesting as perpendicular trabeculae interspersed by radiolucent marrow hyperplasia along the skull vault give the hair on end appearance, as seen in sickle cell anemia and thalassemia. When rate of growth of lesion is faster and the periosteum does not have enough time to lay new layer of bone, in such cases sunburst appearance can be seen wherein the periosteum is displaced, partially destroyed and or reorganized. This is seen in osteosarcoma, osteoblastoma and hemangioma. The periosteum can show a lamellated periosteal reaction in which multiple concentric layers of new bone are laid down, giving it an onion peel appearance on the occlusal radiograph, as seen in acute osteomyelitis, osteosarcoma, eosinophilic granuloma and Ewing's sarcoma. In cases where the rate of growth of lesion is slow, giving the periosteum time to form new layer to accommodate the growing lesion, results in expansion of the cortical plates, giving an eggshell appearance or a ballooning effect. This is commonly seen in occlusal radiograph of lesions, particularly a follicular cyst. Horizontally arranged bone trabeculae give the step ladder appearance. It is a normal bone pattern commonly seen in the mandibular regions, but may also be seen in sickle cell anemia. Partial pulpal obliteration filled with globules of abnormal dentine give the thistle-tube appearance, which is characteristically seen in type 2 dentine dysplasia. Unilocular radiolucent lesion seen between maxillary lateral incisor and canine gives an inverted pear appearance seen in globulomaxillary cyst. A unilocular radiolucent lesion seen in the periapical area of maxillary central incisors showing a heart-shaped radiolucency is seen in a nasopalatine cyst. The depression seen superiorly is due to the superimposition of the anterior nasal spine. A diffuse beaten copper appearance has been shown to be related to elevated intracranial pressure from the growing brain in patients with premature craniosynostosis. These markings may appear as multiple radiolucent areas that resemble hammered copper. Degenerative joint diseases lead to alteration in the morphology of condyle. Progressive erosion over the condylar head can lead to small pointed condyle in a large fossa, giving a sharpened pencil appearance. This is seen in rheumatoid arthritis. Flattening and osteophyte formation in the condyle results in beaking at the anterior aspect of the condyle as seen in osteoarthritis.
The radiographic appearances are time-tested and a radiologist can swear by them. I learnt it from my teachers. Today, with upgraded audiovisuals, it's easy to connect and easy to retain the knowledge. Thank you.